You're listening to Florida Matters. I'm Matthew Petty. The need for doctors across Florida is growing, along with the state's population. By 2035, Florida could be short of 18,000 physicians. And it's not just doctors. The state could also be facing a shortage of nearly 60,000 nurses by 2035. One sign of the growing need, Sarasota Memorial Hospital recently opened a new, expanded emergency department in Venice.
We have had increasing demand, so this is really coming just in time. We've gone from our original 28 beds to a 61-room, 30,000 square foot emergency care department.
That's Julie Polashek, Chief Nursing Officer at Sarasota Memorial. Healthcare providers across the Tampa Bay region are training more doctors to meet the need. Baycare, the non-profit hospital system, aims to add 650 residents by 2029. Coming up in about 15 minutes, you'll hear from a Tampa Bay physician who's helping train new doctors in family medicine. But first, here are two people with different perspectives on the need for doctors, nurses, and other medical professionals as Florida's population grows. We're joined by Jeff Johnson. He's the State Director for AARP Florida. Jeff, thank you so much for being with us.
Thanks so much for the opportunity, Matthew.
And Acadia Jacob, Advocacy Director at Florida Voices for Health. Acadia, thank you.
Pleasure to be here.
Well, Acadia, let me start with you. What are some of the concerns for patients that you're hearing over access to medical care?
Absolutely. I think across the board, Florida Voices for Health is hearing that folks in our state are dealing with very few resources when it comes both to healthcare coverage as well as then opportunities to get access to care. We travel all around the state, and I think both folks in metropolitan areas as well as our neighbors in rural counties are really struggling. In particular, our rural counties have been so hard hit by recent hospital closures. So at Florida Voices, our capacity is to collect the stories of those Floridians and try to get them empowered, connected to resources and opportunity to influence health systems change.
I wondered too, given what Florida has gone through collectively over the last hurricane season, do you see more of these stories bubbling up, particularly from folks in rural areas when there's a disaster as well?
Absolutely. I think in terms of economic resiliency, having opportunities to access healthcare, affordable quality health insurance is something that can shore up immediate needs. And a lot of folks who have dealt with different forms of harms from our recent storms have found themselves, in awful situations seeking access to care. I know we worked really closely with other partners around the state to ask for extra contingencies for Medicaid recipients to ensure that they could get access to needed services following the most recent storms. And just to say, one of the best ways to shore up economic harms and prevent against them is to invest in these programs like the Medicaid program that serves so many low-income folks right at the margins, who are the most vulnerable to these big storms that are becoming increasingly frequent.
When you talk about the difference between healthcare for rural patients and healthcare for people in the urban areas, are there some differences or different challenges that they may face, or are they pretty much the same? It's just a matter of finding a doctor or a hospital that is easy for you to get to and for you to get the care you need?
I think that's a really excellent question. First of all, I'll say that across the United States, healthcare looks different. Florida is one of the last 10 states that hasn't yet expanded the Medicaid program. So what that means is there's a lot more folks who are caught in our healthcare coverage gap, who just don't have, healthcare coverage to begin with. And a lot of folks then, basically end up having to choose to go to the emergency room in an emergency or otherwise deal with really high medical costs that they have to pay out of pocket. So within that landscape, on top of that, our rural communities and, Florida, almost more than half of our state is really rural, and quite a few areas, whether or not officially called rural, also deal with some of the same challenges as our official rural areas, deal with quite few healthcare resources, and the economies that keep those hospital systems that are there are quite unique. So we've seen, I'll just say, in the past few years, a a concerning number of closures of critical access hospitals across rural Florida. And this is in part due to the fact that because of our lack of expansion of Medicaid, there are such high uncompensated care costs that these smaller institutions are having to foot the bill for. Ultimately, it's cities and communities who are paying for those who don't have access to quality, affordable health insurance. And we're also seeing then where there are still institutions left, people who are struggling because some of the more costly services like labor and maternity wards are being closed preemptively. I think across rural hospitals right now in Florida, 86% of labor and delivery wards have been closed. So just to say, that leaves folks who already might be really far from the nearest city, and for whom paying for transportation might already be a barrier. Sometimes we're seeing folks with drives up to an hour, 2 hours just to get to the closest care center, which of course in an emergency or when one has a new baby can be really the difference between life and death.
Indeed. Well, Jeff, AARP caters to older Floridians, and more than 4.5 million Floridians are over 65, so that's a pretty big slice of the population, and a lot of people who have health needs that may be different to younger Floridians. So what are some of the challenges, healthcare-wise, that your members are facing around this issue?
Well, thank you, Matthew. Yeah, and you're right. When you think about the broader 50-plus population, for those of us who may not quite be 65 but are headed in that direction pretty quickly, it's an even larger slice of the population. And what you discover is that a lot of the healthcare spending in the state is really driven by older adults. What we heard last year, headed into legislative session when the Florida legislature was discussing healthcare workforce issues, were that really kind of across the income spectrum. So not speaking solely for those who might qualify for Medicaid, there is a concern about the potential shortage and the actual shortage of physicians. Some of it in the Southwest Coast particularly was exacerbated by Hurricane Ian, if you can remember that far back. And so I would expect that that has continued to be the case here. A lot of this is generational, where the physicians and nurses and other care providers are reaching retirement age themselves, and the state's economy has not been geared to really attract that next generation of healthcare providers, leaving us caught short.
Yeah, and that number, by 2035, I think the shortage of physicians is like 18,000, and then if you think about nurses, it's nearly 60,000 nurses the state could be short by 2035. So a lot of resources needed, and it's not just doctors and nurses too, right? There's other medical professions that are part of that system where they do need to hire more folks. When you hear from your members, what are some of the chief concerns you're hearing? Like, what would be the biggest issues that you hear people saying, we just, this isn't working for us?
Currently, one of the things we hear most often are significant delays in being able to connect with specialists. Now, sometimes it's just getting appointments with primary care providers, especially as perhaps longtime primary care providers head into retirement, finding new ones, but then just being able to get in the door. And if there's a referral to a specialist, having to wait months for that appointment is a concern. So that's kind of on the physician side. Now, the other part, and this goes to your last point, is that on the front lines, and I think even more so of hospitals, but especially nursing homes, where it's certified nursing assistants and other frontline care providers who are providing the care and feeding that keep people going, there are significant shortages across the state that can lead to neglect. It can lead to not monitoring patients who may have cognitive difficulties, who wander away. It can lead to bed sores, can lead to all sorts of things. So as we're looking at this crisis that is coming down the road towards us, we need to address, how do we attract more physicians? How do we attract more nurses? But how do we attract and activate more frontline workers to make sure that people get the care that they need?
Acadia, I mean, waiting a long time for an appointment to see a doctor can affect people of all walks of life, all across the income spectrum. But I mean, are you seeing more folks who are, more vulnerable or maybe worse off because of a doctor shortage?
Absolutely. Yeah. I think cumulatively we're seeing impacts across the board. And I'll just say, I think it's particularly the folks who are most vulnerable, who are most impacted. I know last session in particular, there was some amazing work specifically on increasing access to care for folks with disabilities, who rely on these frontline workers, home care workers, to come in. This is a low-paying position, and in this day and age, when there's already so many workforce shortages, folks sometimes can get paid more working at a McDonald's or a Target, right? And these jobs are hard to hire for. They're physical. They require a high intense emotional connection to the work. And just saying, I know there's been amazing work being done to increase both the salary levels and the benefits for folks who are working in this field to try to make sure that, yeah, especially those who are most at the margins. We have 22,000 folks on the iBudget waiver waiting for access to care through the Medicaid program. They're eligible, it's just underfunded, right? And part of that is this like workforce shortage. So folks are waiting decades for access to care in that regard. I think, on our end, more regularly, I think we're seeing, I know the Altarum Foundation has found that 1 in 4 Floridians are like delaying their medical services just because of high care costs already. So it's just this, whole system is ultimately like pushing needed primary and preventative care further and further out for so many.
Now, Jeff, you also were talking about what was happening legislatively. Acadia mentioned that too. Last year, we had the Live Healthy Act of 2024, including more funding for training, efforts to make it easier for medical professionals from out of state to come and work here, and funding for charitable clinics and other measures. Are you seeing that make a difference? And are you hearing some signs that there may be more legislation coming up in 2025 that could help as well?
Good questions. And I would say that most of the changes that were made in that law are ones that are going to take years to take effect. When you're talking about increasing the educational pipeline, it takes a while for people to move through that pipeline. There are a couple of things that we think are both concerns that weren't addressed in that law and opportunities that the legislature could do to speed things up. One would be if they made it easier for people who have retired here as healthcare professionals from another state to reactivate their license. We've heard of doctors and nurses alike who've said, I've thought about coming back to work part-time, but it's just too hard to get licensing here. So while they've made it easier for active professionals to work across state lines, they could do a little more there. The other thing is many people who are caregivers begin as family caregivers. They take care of mom or dad, and they realize that this is something that, though super hard work and doesn't pay nearly enough, is really meaningful to them. And we could do more to sort of make more efficient the pipeline from family caregiver to professional caregiver. We don't make it easy to credential somebody for things that they've been doing for 5 or 6 years for a loved one and be able to credential that professionally. But I'd say the bigger trend long term in that Live Healthy Act, which was, again, a net positive that we supported, is there wasn't a lot of emphasis on older adults. To the extent that there were any sort of picking of winners and losers in terms of populations to serve, it was primarily around pediatrics and OBGYN, as it should be. That's super important. But we're woefully short on geriatricians and people who are just trained in older adult medicine, which, as you pointed out at the beginning, is a major difference that happens over ages. And something that, given Florida's population, you would think that we would want to invest more in making sure that the general physicians across the state have a lot of awareness about the complex health needs of older adults.
Acadia, are you seeing some areas? I mean, when you look at a place like Tampa Bay, it's a pretty diverse population here. We have rural communities, urban communities. There's a lot of people living in the Tampa Bay region. But, I mean, if you think about it kind of globally, are you seeing some areas better served than others when it comes to healthcare?
I think that's a really excellent question. And I would say, in part because of the Hillsborough County Health Plan, which is one of a few safety net plans that exist across our state that help folks who are really struggling to get access to that sort of stopgap care. It helps fill in where the coverage gap leaves so many between the Affordable Care Act plans and Medicaid eligibility. That certainly does offer opportunities to many who otherwise wouldn't have choices and would have to make the decision between paying out of pocket or potentially not receiving care. So I would say that's been incredible. And, alongside, we work really closely with healthcare navigator partners in the region, including the Family Healthcare Foundation and covering Florida. But just to say, I think one of the rollouts that had immediately led to stirrings across the state was this increase in the sovereign immunity threshold that allowed so many of our partners in charitable clinics, federally qualified health centers who see patients who may or may not have insurance, they might be underinsured, who see those patients to see folks up to a higher income threshold. What I will say is Live Healthy in raising that threshold made it much easier for a lot of folks to get access to needed care. This bill included many wonderful, long overdue provisions that we celebrated. It didn't come with any budget increases for those organizations around the state. Then I'll say also with that, we did see the Live Healthy bill included some increases to reimbursement rates for some providers. I believe oral health providers receive some higher reimbursements. But what Jeff was saying before is true. People, it is so hard, even if you do have access to insurance, to find a Medicaid provider. Even if you live in an urban area, these providers are paid pennies on the dollar compared to programs like Medicare, let alone private pay. Especially for our more rural Floridians, it can be exponentially harder, especially if you have any complex needs, disabilities, other factors that influence the type of provider you go to, that specialist you might need access for. So just to say, the rollout has been ongoing. We've been working really closely, trying to educate all our wonderful partners who are providing care at the margins, and trying also to uplift these concerns that are coming through about what additional policy changes might be needed to continue to work forward from Live Healthy.
Well, I want to thank you both for joining us. You've been hearing from Acadia Jacob, Advocacy Director at Florida Voices for Health, and Jeff Johnson, State Director for AARP Florida. Thank you so much for joining us. You're listening to Florida Matters. Up next, hear from a doctor who wants to inspire the next generation of family physicians in the Tampa Bay region. You're listening to Florida Matters. I'm Matthew Petty. Over the next decade, the need for doctors, nurses, and other medical professionals in Tampa Bay is only going to grow along with Florida's population. One of the ways to try and meet the need is by training new doctors. The non-profit Baycare system has hospitals in Hillsborough, Pasco, Polk, and Pinellas counties. They plan to add 650 new residents by 2029. And some of those residents are getting training in family medicine at Tampa Family Health Centers. They also provide services like pediatrics, OBGYN, and dentistry for patients with and without insurance at clinics throughout Hillsborough County. Dr. Gaelle Laurore-Fray, Executive Vice President of Medicine and Medical Education for the Tampa Family Health Centers, thank you so much for being here. Appreciate it.
Thank you for having me.
The need for nurses, doctors, and other professionals can be a real challenge for patients waiting to get an appointment with a specialist, right? And for medical providers looking to recruit new staff. So can you explain what it means for Tampa Family Health Centers?
Well, we are community health centers, and we have been in the community for about 40 years now. And a lot of what we do is assessing the need of our patients and making sure that they have adequate access to care so that they don't have to wait for a significant long time before they can actually see whether it's a nurse practitioner, a physician assistant, or a physician, and making sure that they have access to, the innovative, the new medical treatments that are out there. So for us, we felt that it was very important to get involved in medical education because having residency program within Tampa Family meant that we had an extra 6 bodies, an extra 6 new physicians who are out there and are passionate about community health, passionate about taking care of our patients. And it also meant that our patients could get in to see our physicians much faster than they normally would.
Do residents want to stick around and keep practicing family medicine in Tampa Bay? Because what I've heard is that that's one of those specialties that it can be a little hard to recruit new junior doctors into.
Correct. So it's It's particularly challenging. The shortage has particularly affected primary care specialties, so meaning family medicine and pediatrics being the two most common ones. When we recruited this group of residents, we particularly were looking for residents who had interest in staying within the community. And I'm proud to say that a lot of our residents, they have a special place in their heart dedicated to community health. They are very much excited about the care that they're able to provide for our patients. And all of them have addressed their interest in staying in the Tampa Bay community. So moving forward, I do believe that the residency program will do wonders in bringing in new physicians that are interested in staying exactly in the area and particularly caring for this population of patients.
Has something changed, do you think, since you started practicing medicine? Like, presumably you got into it because you have a passion for it. So what do you think might have changed in the meantime that people are saying, I'd rather practice something different?
To be honest, I'm not sure what exactly has changed. One thing in being in community health that I've witnessed is that it's not for everyone. People go into medicine for different reasons. We all want to help patients, of course, but there are those of us who have, I guess, a more particular interest in serving the patients who have more hardships, I would say. They don't have access to transportation. They don't have access to insurances. They have so many different social determinants of health that they have to deal with that sometimes it could be a barrier to care. For me, I particularly fell in love with community health during my residency period. So it's exciting for me to now being on the other side of things as far as training the new group of physicians to see the residents have that same interest as I did before and just being committed to providing the care within the community health setting.
Is that something, though, that can be taught, or is that something you really have to have a passion for from the get-go?
I think you need to have the passion there. You have to have the willingness to learn how to care for this particular vulnerable group of patients. You have to be willing to look beyond the books and look at, their financial situation, look at their emotional status, look at their family environment and pretty much bring the care, meet them where they're at instead of just going by, the standard medical care, I would say.
So what's your elevator pitch to the residents beginning or people who are considering getting into family medicine? Like, how do you tell them about what makes it worthwhile for younger doctors to get into?
I really think, and of course I'm biased, but family medicine physicians, we are taught to pretty much take care of the patient literally from birth till the end of life, right? We are able to see patients in their most vulnerable periods and we're able to celebrate, the biggest successes for our patients. It just puts us in a position to really develop that relationship with your patient from the moment you establish care till they leave your care. I've been in the community for 10 years now and I still have patients that I've seen from day one and they just they don't want to see anyone else. But at least now I know that I can train the next group of doctors to take care of my own patients if I were to ever decide to leave. But family medicine doctors, I think, are in a very unique position to really help guide patients' health care and just really help determine what we can care for within our own practice and what kind of services that they will need. Let's say they would need to see any kind of specialist for any specific medical conditions.
So you've got 6 trainees,
Per
right?
year, correct.
Is that enough? Would you like more?
The plan right now with Bay Care is to potentially expand to 10 residents per year, but I don't think we're going to go beyond that. But of course, it's always evolving. We can always assess to see, what the needs are and see if we can accommodate more.
You're really focused on the primary care aspect of
Mm-hmm.
things, right?
Mm-hmm.
But you're also kind of looking at what patients' needs are and sort of thinking about everything from soup to nuts, their financial situation, transportation, and that kind of thing. So when you kind of think about the healthcare system in Tampa
Mm-hmm.
Bay in general, what do you think, like in an ideal world, what would a well-resourced healthcare system look like for the people in Tampa Bay?
Well, actually, I think Tampa Family has, again, we've been in the community for 40 years, so we've had a good time to kind of assess our community needs and figure out what our patients really need from us. And based on these evaluations, we've been able, for example, determine that having telehealth available for our patients would really help them address some of the barriers. So patients don't have to take off from work. They don't have to, catch 3 or 4 buses to come to us. We're prepared to take care of our patients just by having the telehealth access for them. We also have mobile units, for example, where we take our buses out in the community, either near the homeless centers or even schools, where we bring the mobile bus and we can provide dental care as well as medical care to our patients. So we really do try as a community health center to bring as many services to our patients and meet them where they are. Our pharmacy, for example, are fully equipped to do medication delivery. So we have a small group of people who go from door to door to bring our medications to our patients, especially if they're having any issues with getting to our buildings.
Mm-hmm. I guess when you look at Florida as a whole, there is this fairly well documented need for doctors.
Mm-hmm.
You're doing your part, taking
Mm-hmm.
part in this training program,
Mm-hmm.
but it takes a long time to get somebody up to speed in this field, right? In any field in medicine. So, and we are talking to you, I should note, between patients, right? You've taken a little bit of time out of your busy day to have a chat with us, which we appreciate, but that can be a challenge, right? I'm just sort of wondering, from a physician's point of view, boots on the ground, what does the doctor shortage feel like for physicians who are already in this field, already practicing?
That is a tough question. Because honestly, I take it one patient at a time. And I know that at least from, the Tampa family standpoint, recruiting very well trained, for example, you mentioned that the shortage affects all of us. It's not just physicians, right? But recruiting very strong, trained nurse practitioners and physician assistants, for example, to work right alongside physicians definitely does help address the shortage of care for our patients. But for me, as long as I get to do what I'm passionate about and see my patients and utilize all the different services that Tampa Family has set up for our patients, it really does help kind of alleviate some of that burden that the patients may be experiencing. It really speaks to my passion also in being involved in the graduate medical education, because I get to work with those residents. I get to train, at least 6 new residents per year, and I get to show them exactly how I want them to provide this compassionate care to our patients. And even though, they won't be on their own for another 3 years, but I know every year it's an additional 6 residents and an additional 6 physicians that I'm training to care for this population of patient exactly how they should be cared for. So the residency program definitely does, it's definitely a light at the end of the tunnel when it comes to addressing the physician shortage here in Tampa Bay.
Well, Dr. Gaelle Laurore-Fray, Executive Vice President of Medicine and Medical Education with Tampa Family Health Centers, thank you so much for your time. I really appreciate it.
Thank you so much, and thank you for having me.
That's Florida Matters for this week. The executive producer is Grayson Doctor. Engineering support from Jackson Harp. Subscribe wherever you get your podcasts and watch on YouTube. I'm Matthew Petty. Thanks for listening.